Hello there, my name is Nathan Garcia, and thank you for joining me today on NowRPM's webinar demo. And today I'm going to walk you through how NowRPM's patient monitoring program works. But first, let's go ahead and clarify some things here on a brief agenda regarding RPM. Number 1, we'll first discuss what remote patient monitoring is as a whole unit. 2, we'll go into how an RPM program works. And then 3, the barriers that really need to be overcome to get it up and running. 4, a breakdown of what we have compared to other vendors, like decision criteria to choosing an RPM platform. 5, the RPM CPT codes, the reimbursements and details of what Medicare will pay. 6, the overall economics of remote patient monitoring. 7, we'll do a quick Q&A on any questions you guys may have regarding RPM. Number 1, what is remote patient monitoring? So for some of you here that don't know what remote patient monitoring is, from a big picture perspective, it is Medicare reimbursing and how they plan to invest resources to reduce the rates of hospital readmission rates. That's why Medicare has been paying an exorbitant amount of money year after year just for hospital readmission rates. So they are incentivizing healthcare providers to remotely monitor conditions such as congestive heart failure, hypertension, diabetes, to ultimately keep patients out of the emergency room. So this enables clinicians to identify conditions before they potentially become life-threatening. And as I mentioned, Medicare is really looking to keep patients out of the emergency room. Medicare has also stated that it's going to be at no cost to the Medicare patients who have at least one chronic condition that really needs to be monitored on an ongoing basis. And with Medicare being the most predictable payer in the United States, you know that you're going to receive the reimbursements for the time that you do spend. Number 2. So at the end of the day, how does a remote patient monitoring platform work? First, to get started, you obviously have to enroll. And then, so do your patients. Then with that also comes patient consent to automatically transmit their data. Upon this, the devices are then shipped to the patient. From here, the patient uses the devices. From here, once the patient starts using the devices, you automatically start receiving those readings, so you can start reviewing those clinical results in real time. And obviously time is money, so once that time has been spent, you just bill Medicare for the reimbursements, and they cover all of the costs associated with remote patient monitoring. And just to add on here, I think one of the key ingredients to any good RPM platform is that when something does test out of range from one of your patients, that you do receive an alert so that you're obviously alerted to that abnormality, but also you can be directed directly to the patient's file within the portal so that you could review the results and act accordingly. Number 3, challenges. What are the potential roadblocks for practices and their patients? Obviously, when you're running a new program, there are always a few barriers to get it up and running. And as I'm sure you know, the Medicare population is always not the most tech savvy. I mean, from experience, I think of myself and on my dad's side of the family, I'm on the phone with my grandmother at least twice a week, just trying to walk her through how to log into social media on her phone. And with that, some solutions for remote patient monitoring are going to require manual data entry, which is obviously going to create additional barriers when a patient does test their vitals. So the question gets brought up, I did the test, but I must have forgot to submit it. So that is always causes some friction between receiving the patient's vitals. Some devices will need a plethora of applications to be connected. And with that, with only 60% of the Medicare population having an internet connection within the home, remote patient monitoring needs to have the ability to encompass the entire Medicare population, and with some platforms will require a multitude of applications just for the initial setup. And then lastly, when starting a new program, there's always financial risk obligated, so some RPM providers, they will require an upfront payment for the devices, as well as sometimes lock you into an ongoing contract as well. Some other factors to consider here: your medical practice, it's not a warehouse. Some other companies will require inventory management when you do purchase those devices up front. And then with that comes the human resources and capital, both required to maintain that inventory, as well as monitor your patient's vitals and follow up with them to make sure that they are using the devices properly and correctly. And then lastly, this begs the question, who's going to enroll these patients? Who's going to contact them to get them set up and educated? Whether that be myself or some other company that I'm going to be working with that's going to do that. Number 4, when it comes to making a decision when selecting a remote patient monitoring platform, it's obviously going to be a few decision criteria that it really comes down to. And for that first one, it's risk. When you first sign up with NowRPM, you are never required to have any upfront payments for the devices or administrative fees. And that same goes for all of your eligible patients on Medicare. And through our most extensive offer, we assign your patients our NowRPM box, and what that ultimately means is that your practice can try out our already out-of-the-box RPM devices so that your patients aren't just limited with 1 or 2 devices at a time. Time to implement. And ultimately, as you know, time is money. So the question comes up, is my clinical staff going to be responsible for maintaining the system? To briefly answer that, with our AI, it handles the majority of the administrative work involved with starting the program, from device shipment to making patient enrollment lists and to checking their eligibility, so that way your clinical staff will not be disrupted nor create any additional work. And then lastly, full service support. Support comes into question. Who's going to be handling the support if a patient needs batteries to replace in their devices, or the device isn't transmitting data, whether it's just a simple 10 patients, or all the way up to 10,000 patients? With NowRPM, we have a support line based here in the United States for your patients, just in case if they have any questions. The result is that NowRPM will save you hundreds of hours for you and your clinical staff, compared to our other competitors who require you to handle all of this up front in order to get the program off the ground. Real-time alerts. Alerts from readings will be then sent over to the portal, and that's where you and members of your staff can log in at any time to review. And lastly, as I mentioned before, real-time alerts are absolutely critical when it comes to patient adherence. This also includes our medication adherence reminders that we identified with your patients upon enrolling. Being able to follow up with your patients in real time so they can stay out of the emergency room. And before I dive in here, how familiar is anyone with the CPT codes and the reimbursements as put forth by Medicare? Well, excellent. Certainly happy to clarify everything here, and it's great to see that some people are familiar with the CPT codes. And to start off, we will start with 99453. One thing to note is that these dollar figures are the national averages for reimbursement, and I'm sure, as you know, Medicare does reimburse based on locality, so these figures do vary. Starting off with 99453. 99453 covers getting the patient set up and ultimately using the platform, so it's only billed once during the patient's lifetime. The next three codes are all monthly, where 99454 covers the cost of all remote patient monitoring devices and the services rendered on the back end as well. This also includes the 16 days of data collected from the patient in a 30-day period. 99457 and 99458 cover the reimbursement for the time that you spend utilizing remote patient monitoring data, so 99457 covers the first 20 minutes spent throughout the calendar month, and 99458 will cover an additional 20 minutes as billed in 20-minute increments. So the ultimate revenue potential is if all these codes are billed and a total of 60 minutes has been spent with the patient throughout the calendar month, as $207 is the national average if all CPT codes are billed out. Number 6, economics of RPM. But obviously there is going to be some cost associated with remote patient monitoring. So here on this table are some details on our service fee, which will vary somewhat again because of Medicare, since they reimburse based on locality. So these will be the national averages. $299,520. The annual yearly revenue potential for a practice for 200 patients. And this is obviously if all codes are billed and a total of 60 minutes have been spent with the patient throughout the calendar month. This also includes our service fee as well. Now, that is not going to be the case for every single patient, so let us look at a more conservative approach with an estimate of what your practice will make by utilizing remote patient monitoring. Now you'll see here, this is where our service fee is removed, and with 99458 removed as well. So this is definitely a more conservative approach. And with this, if the minimum of 20 minutes has been spent with the patient throughout the calendar month, looking at just 50 patients, the annual yearly net revenue is around $38,400. And all the way up to 1,000 patients, with the annual yearly net revenue is over $1,497,600. So, as you can see, RPM represents the single, easiest, and quickest way to generate additional revenue to impact your practice towards your bottom line. So, as we discussed quite a few things here in terms of remote patient monitoring as a whole unit and the economics involved with the program over time. Now, where does NowRPM fit into the picture? Well, we offer our most extensive program at no upfront cost to the provider, and the decrease of administrative time that your practice could spend. And as I mentioned before, our AI handles the majority of the administrative work involved with starting the program and with the help of our patient success team, such as inputting the patients into the system, filling out those boxes with patient information that I'm sure you've seen 1,000 times, as well as contacting the patient to educate them and get them set up. Time. Time is always money, as I mentioned, so the ability to scale rapidly is certainly achievable within our program. And then for your patients, it is not going to be at any upfront cost for the patients themselves. We cover the devices per patient, as well as covering the shipping. When it comes to transmitting those patients' vitals, all of our devices are 4G enabled, so they are pre-configured as we ship them directly to the patient's home. So they don't need any sort of configuration upon setup. And on top of that, some of the devices require consumables, the blood glucose meter specifically, as I'm a diabetic myself, and I can certainly understand the challenges faced when you run out of test strips. I mean, I've gone to a pharmacy before in a complete fire drill after I ran out myself, and they're completely out of stock, and I was left with nothing to test with. So with that being said, we cover all of the test strips and lancets as we ship them directly to the patient. And since we frequently check for medication gaps within our system, we will know automatically when a patient is due for their next refill. So if a diabetic patient is testing their blood sugar levels regularly, we will know if and when we need to send out test strips to that individual. So just feel free to type down any questions that any of you guys might have on the chat below, and then from there I'll be able to answer them in the order that they were created. Okay, here's a question. And the question is, who handles billing? So this is currently handled through our organization. We simplify the process and help generate the claims as you use the platform. So right now we are billing CMS directly for the reimbursements and then debiting the account that is on file and then minus our service fee. All right, here's another question. Is there any copays? Yes, as Medicare Part B services, there is a 20% copay. Any questions about the devices? Okay, here's another question here. Is this only for Medicare patients or can this be for private insurance patients? Is this only for Medicare patients or can you do this for private insurance patients? To answer that, RPM codes are considered evaluation and management services, E&Ms, and despite the request to allow other providers to bill for RPM services with the 2021 final rule, RPM confirms that it can be ordered or billed by the physician or non-physician practitioners who are eligible to bill for Medicare services. So private payers may reimburse for RPM services, but they are not required to do so. So private payers that do reimburse for RPM services may have different requirements and different services aligned. All right, here's another question. What are the exact rules and who could do the monitoring? So any sort of qualified clinical staff within the practice can conduct the monitoring itself, whether it be the physician, physician assistant, nurse practitioners, or any clinical nurses as well. All right, I see we have another question here. Will we need individual malpractice insurance? So if you are only using NowRPM for your practice and for your patients only, you will be under your own policy. But if you decide to service our patients, you'll be under our medical director's liability insurance policy. Great question so far, you guys. Okay, here's another one here. Does there need to be face-to-face interaction? So only if the patient is new or has not been seen by their provider for more than a year. And then in that case, the provider must conduct a face-to-face visit with the patient. And that visit would actually be reimbursable under evaluation and management. Good questions, you guys. Can the patient be home? Yes, a patient can be home while enrolled in the RPM program. Are there any geographic restrictions? No, RPM is considered a telehealth service, so therefore there are no geographical or originating site restrictions. But the reimbursements are based on locality, so those will differentiate over where the location is. Okay, here's a question for 99454 and 457. Will we need to at least spend 20 minutes of time with that patient each month? So with our system, it tracks and logs the time we are spending with any individual patient. And the average spent time with an individual patient is about an hour and a half. And of course, this is done through the use of automation by reminding the individual via text, via call, to take their medications, to check their blood sugar levels if they are diabetic, to remind them about their treatment plans so they could be adherent to their medications. And through the usage of automatic consistent reminders, these reminders comply and generate time. So if a patient has medications to take during the day, each of those reminders per text generates 30 seconds. So if an individual gets 5 texts per day, we're looking at about 2.5 minutes of time per day. And if you multiply that by 30 days, you're already looking into the future by providing that service, that generic service for that patient. And on top of this, as I said before, everything is recorded, documented on the back end of our system. So that way, whenever there is an audit, whether it's from Medicaid, from Medicare, or private insurance, we're able to provide full transparency of the services rendered and pull any backlog on activities that have taken place for that patient. All right, I'll just wait a few more moments here before we close for the day. And just feel free to type out your questions here, you guys, and I'll answer them to the best of my ability. All right, so that looks like we're out of time. Thank you guys so much again for attending this webinar demo and for your interest to learn about remote patient monitoring and the great services that we have here at NowRPM. You will receive a follow-up email as well as a recorded version of this webinar demo. And I just want to thank you guys again so much. It was an absolute pleasure. You guys enjoy the rest of your day. Thank you.